All right. Well, thanks for that introduction, that kind introduction. And it's good to see everyone. It's great to get together on an annual basis. It's been going on for a while. So those of you who have heard me speak before, you'll hopefully see some familiar stuff, but a fair amount of things have happened in the last year. So the slide deck looks a little different, and I'm hoping that you'll uh, get some traction into some of the new issues that are going on in the area of health equity, cardiovascular risk, and nutrition. So anyway, this is one of my favorite slides, and I usually try to do a little audience analysis and see who can make that diagnosis just from this skin disorder from the picture. Usually one or two hands go up and they usually say the wrong thing, which actually is my point. That is, no one should know what this is. It's actually a case of smallpox. There's a nice electron micrograph of the smallpox virus. And I use it because it's an example of what I think should be happening in our society today, even though this was from the 18th century. This was a situation where there was a horrific amount of healthcare disparity, uh, and not everybody remembers that the North, the Union states did have slavery, and then they abolished it before the South, and everybody knows about the war and the like. But the blacks who were in Boston at the time were particularly susceptible to the illness of smallpox and a high mortality rate. And it looks like smaller numbers, but when you compare it to the percentage of people, it's extremely very high. So, how does it get into a cardiovascular talk? Well, this is why. There was a solution that came up, and that solution was to try and do inoculation, taking a little bit of the pus out of the skin nodule of someone who was sick and injecting it in under the skin of someone who was well. And if they didn't die, which actually did happen, but not very often, most of the time they've developed an immunity and would then be able to survive it if they got it or avoid the illness altogether. And so it saved a massive number of lives. And it took a while in the 18th century for that to catch on, that whole idea of inoculation. And ultimately, you could see that the number of deaths just plummeted over time and to the point where I should be able to show this slide and nobody recognizing it is it anymore. Well, so this was an example, and there are plenty of other examples. If I fast forward to the 19th century, this concept that I'm showing you here, the best example probably was yellow fever in the Panama Canal. I know it's a political issue today, but fact is that France had given up because of the huge number of African uh, diaspora from the slave trade in the Caribbean. And they were dying in droves because of yellow fever. And the United States got in there, and Walter Reed named a hospital after him, figured out that it was the particular mosquito that was carrying the yellow fever, did mosquito abatement, and there went that. Fast forward to the 20th century, and you had polio, and then you had HIV. 21st century, you had COVID. Every time we come up with a solution, we were able to get rid of some horrible healthcare disparities that occurred with each of those viral illnesses. And so the idea here is it isn't just about trying to do everything equally or equitably, but instead of trying to figure all that out, why not just get rid of the disease? And that's what I'm hoping that we'll talk about today. So our burden for cardiovascular disease, hopefully everybody recognizes that it still is number one. Very few countries that are developed countries still have cardiovascular disease as number one. And you could say it's industrialization, it's risk factor recognition and management. The industrialization is leading to cancer rates that are falling, but not falling quite as fast as cardiovascular disease rates. And in the United States, it's just not true. We're the one advanced country that still has cardiovascular disease as the number one killer. Very expensive. And yes, there are huge healthcare disparities, and I'm going to cover a few of them, but I'll be mentioning others as I go through. And obviously, we've known about the issue with African Americans having so much more heart failure, hypertension, so much more heart attack, stroke, kidney disease. 12% of the US population, but 35% of the dialysis patients. And it's all related to similar issues. There are other folks who have a similar profile, like our Appalachian population also has a 30% increase in mortality rate compared to the rest of the US. And our South Asian colleagues, so many of whom are in medicine, are, are actually 40% higher. And so there are ethnic disparities all over, all of which need to be addressed. But the unifying theme that you're going to hear over the next hour or so is the nutritional habits that give us components that increase cardiovascular disease, whether that's sodium, sugar, saturated fat, cholesterol, changing the microbiome. So if you had to run away from the lecture, you just heard the real outline. If we could avoid those 5 things, we would actually do some substantially better. Well, and this is the slide that I don't actually know who started this. I first saw it with Dean Ornish, but I've been adopting it ever since because it hits home. Just got back from the American College of Cardiology meeting in Chicago last weekend. And the theme was an amazing amount of innovation, new devices, new drugs, a little bit of which I'll talk about today. But ultimately, everything we were doing at that meeting was about mopping up the floor instead of turning off the faucet. And the outgoing president, Kathy Biga, historical, that the first time that a nurse who had become a hospital CEO and amazing administrator had actually become president of a large medical society. And she's from Chicago. We've known each other for I don't know how many decades. And so I just commented to her at the end of the meeting, congratulations, Madam President, but when are we going to have a convention with some attention to prevention? Because it really is something that we should be doing full time. But no, don't want to take away from all of the developments that have been happening in cardiology. I just want to say that wouldn't it be great if we didn't need them? Because diet is the #1 cause of poor health, and this has been around for quite a while. And the argument that I hear nowadays is that we're so ill that we have military readiness issues with our young people. They're so overweight, sitting around eating American food, not exercising nearly enough. So we end up with this burden of diabetes, hypertension, elevated cholesterol, all leading to earlier ages of cardiovascular disease and heart attack. The fatty liver also correlates with heart disease and is something that is really increasing in frequency and severity. The argument nowadays is that really 80% of our healthcare dollars spent on preventable chronic diseases that would improve if we fixed the diet in our society, or is it 90%, which was quoted to me by artificial intelligence a few days ago. So we have a burden, and it's a very expensive burden. It's now over $1 trillion a year that we spend on chronic diseases that are from the poor diet. And that is the true cost of food, as this was put out by the Rockefeller Foundation. Everyone is looking at it. If you're thinking about the country or human health or animal rights or planet sustainability, it's all pointing to the same issue, and that is we need to do a much better job with food. We have some guidelines, and the new guidelines for 2025 have been proposed, and it would be great to see what the final document is like. And I'm not going to go over that because the recommendations from the advisory group are not always taken up. And so later on in the year, you may be disappointed, but so far, we do have dietary guidelines that say that people should be doing a more plant-forward diet and eating 2 to 3 cups of vegetables per day and fruit. And this is something that most of us in the United States do not do. Instead, we have patterns like what was called out by the University of Alabama, Birmingham, as the Southern diet. Now, it wasn't that all of the diets were healthy. This is what their data looks like. If you look for heart attack, stroke, death, uh, and the absence thereof. And so this is a Kaplan-Meier plot. If you haven't seen it, it's just over time, over a 5-year period, how many people who are at risk end up with a bad outcome. And if you're eating a lot of sweets and fats and convenience food, alcohol, great. It's not, not do so well. They defined a plant-based diet as just a predominance. It could be like 51% plants. And not necessarily a healthy whole food plant-based diet. Okay. But that did over a 5-year period seem to distinguish itself. That is, if people are eating more fruits and vegetables, they came out better. But the Southern diet, which is also called soul food, where it's a lot of organ meats and putting fat back in the collard greens and having uh, not just chicken but fried chicken and deep frying everything, a lot of sweet tea. That kind of pattern is uniquely associated with heart attack, stroke, death, as well as kidney failure. And so this is UAB's sort of summary slide of what happens when you eat that kind of diet instead of what you could be doing with that's more plant-based. I'm going to point out a handful of issues that I think are contributing to this that we all ought to take on with our our legislators and regulators, and really become an activist and say, why would we tolerate this as a society? And so you have a lot of political changes in Washington, D.C. right now. And a lot of it is about the finances. Well, I'm saying that the finances would be a lot better if we fix the diet. So we do have a preponderance of fast food eating. They're very viable businesses, and that's because we market to people. They are very effective at marketing. The fast food industry, if you look at television commercials, it's the majority of the commercials on food. And we published this a couple of years ago that the fast food chains are really dominating, and what they are showing, even to young people, is unhealthy food patterns that you can actually score how unhealthy they are. The refined grain in that hamburger, the hamburger itself, the ketchup with the high fructose corn syrup, the extra large soda or soft drink sweetened beverage, or artificially sweetened beverage. All of them have literature showing that they increase disease, illness, chronic disease, or mortality. And yet we market them, and we market them to children. And something that I would love to see is regulation or legislation that curtails the frequency of these commercials and try to ban them so that we're not sending this message to children that this is desirable. Unfortunately, it is I'll keep talking about healthcare disparities in and out. And, a lot of as I learned by moving from Chicago to Louisville 3 years ago, our healthcare disparities are not just about race. They really are about income and education. And people who have lower income tend to watch more television. So they're more highly affected by this advertisement of food that no one really should be eating very often. And so this was published and got a lot of press almost 20 years ago, that the fast food industry was picking on the poor, lower levels of education, Black, low-income neighborhoods, okay? And I'm saying it's really the opposite of that. That is, the African American neighborhoods that I grew up in on the south side of Chicago had a lot of fast food restaurants because we buy the stuff. And so if people are not educated in terms of what's healthy food and make those choices and insist on those choices their from their grocery stores and yeah, and even from the fast food restaurants, well, that's on us. We have to do that education at the community level to get people to do better. And so we're going to, the businesses are businesses. They're not in the healthcare business. They're in the keep the franchise open business. And that means that they're going to try to sell the things that people will buy. So we have to change the culture and we have to change the habits of everyone through education. There is actually a publication just from a few days ago that I wanted to include because it emphasizes what we have in the United States more so than other countries. There are areas in Eastern Europe that are similar, but what I'm showing you here is Eastern Europe and the United States. This was published in New England Journal of Medicine 6 days ago. Uh, we have this ongoing mortality difference between the poorest and the wealthiest. And it's true everywhere, but it's worse in the United States and Eastern Europe. And what I'm saying is that a lot of that is the food habit. It's the fact that there's a predominance of unhealthy food that people will eat. And people will try to tell you that yeah, eating healthy is expensive. That actually isn't true. We actually have really good data that if you do beans, grains, nuts, seeds in bulk, it's actually way less expensive than animal products that are actually decaying. Okay, so with that as a background, I want to talk about risk factors and then food patterns. So these are the classic risk factors that we should talk about, and I will try to keep the lens of healthcare disparity as I go through this. Fact is, we have a predominance of obesity and diabetes, hypertension, high cholesterol, and inflammation, hyperlipidemia. And as we look at our obesity issues, it would be nice to have these updated a little bit from 5 years ago. But because it was growing, and I suspect it's grown even more. And I suspect there are more than just this handful of states where folks are more than 35% obese. If you look at the white population, non-Hispanic whites, there's only a very small number of states that at last measure were greater than 35% obese. Kentucky is one of them. And so we see this as a major burden to healthcare here. And in Jefferson County, we have a lot of people who are underserved, have a huge amount of healthcare burden and a lot of poverty. And our Medicaid population in Jefferson County is about 22% of all of the state. And one of the major issues that we have is nutrition and obesity. If we actually switch over to the Hispanic population, you see that that number of states with more than 35% obese increases dramatically. But if you look at the African American population, it's almost inverted. That is, there are a handful of states that either don't have African Americans in large numbers or have them at a more healthy weight. It's almost the entire country. And I like to show this slide just to remind everyone that what people used to say was the fat but fit, or the obesity paradox, really doesn't exist. And if it does exist, it certainly doesn't exist for African Americans. So the racial disparities from obesity-related cardiovascular disease are actually a tremendous burden and increasing dramatically. And so the top curve in gray is the African American population suffering the most age-adjusted mortality from obesity. So what can we do about it? Change the diet. And people are doing a lot of bariatric surgery, and they're doing a lot of different, obviously the new drugs, the GLP-1 agonists and the SGLT2 inhibitors. And those are actually very effective. And if you get enough nausea from it and it decreases your intake of food, you will lose weight. The problem is that they're losing muscle mass as well as fat cells, and that probably is not the most healthy way to go about it. But how about doing a good exercise program and a whole food plant-based diet? And you will see significant amounts of weight loss, and such as shown with the Dean Ornish diet over 20 years ago. I'd like to remind everyone that it's been tried and it's been said that this is a gland issue, it's a gene issue. Well, it turns out that it's really a diet issue. And so the Cardigene cohort was examined to try to figure out which genes actually made obesity happen. And it turns out it's meat intake, as opposed to whole grains, which are associated with lower weight, lower blood pressure. If we look at high blood pressure, okay, this is also a dietary issue. And you could look at distribution like this one, saying that it's happening much more as people get older, and it's much more if you're African American than if you're Hispanic or Asian or white. But the hypertension is multifactorial. There is a lot of social stress and education correlates with the development of systemic hypertension. And suffering from uncontrolled, unrecognized hypertension is much more common in the African American community. And so we end up with more hypertension-related coronary disease, stroke, peripheral artery disease, aneurysms, end-stage renal disease, which I'll talk about a lot in a bit, as well as cerebrovascular disease and dementia. Well, all of this could be prevented if we just do the vegetarian diet. We have multiple interventions where you say, let's measure the blood pressure before and after you do a whole food plant-based diet. And what you'll see is pretty much all the interventions result in a decrease in systolic blood pressure. The more vegan you are, the more the more likely that the dietary intervention is going to make a difference. One of the nicest examples of this was the very well done dietary approaches to stop hypertension, or DASH diet. And so Mrs. Dash came out of that, or we're using a lot of spices instead of sodium, getting rid of the sodium, and more minerals, less sodium, and wonderful outcomes. The issue was that if you were doing that with a completely plant-based diet or nearly completely plant-based diet shown in red, that's when you got the most vigorous reduction in blood pressure. So whole food plant-based diet is something we should do. Let's move on to cholesterol. And this is one that seems to affect everybody. And you see some non-Hispanic Asian adults, men having a little bit more hyperlipidemia than other folks. And we always like to see refinements and improvements from the Centers for Disease Control. If I was going to redo this, it would be to do the LDL cholesterol, because the total cholesterol doesn't correlate quite as well as LDL or the ApoB portion of cholesterol with cardiovascular events. However, you can see that in terms of healthcare disparities, you have more of this on the Asian side, on the men, and the women are very similar despite all ages. But that's because we weren't always looking at LP little a. It was discovered 60 years ago, but folks didn't start focusing on it until the last decade or so. LP little a, if you haven't had yours measured, if you don't have known coronary disease, it's a good idea to have it measured, because it confers a specifically increased risk for heart attack, stroke, and death. And it's been shown in multiple cohorts that you can see on the left: Mesa, Jackson, Eric, et cetera. And it's somewhere between a 6 and a 46% increase in in cardiovascular events and cerebrovascular events if you have it, particularly particularly if you have a very high level of LP little a. And so you end up with more heart attacks, more revascularization, more stroke, more cardiac death. All-cause mortality doesn't seem to be different, but the events certainly do. The interesting part for this talk is that there are ethnic disparities in that Asians, Blacks tend to have higher numbers, and they are very atherogenic particles, meaning that they tend to cause much more plaque. And there are multiple mechanisms for that. But the key is that, excuse me, that if you are African American, for example, you're likely to have a high LP little a compared to other ethnicities. And it really should be measured so that at least you would know about it and it could change behavior and your tolerance for other risk factors. And perhaps it should make our control of the other risk factors much better. The fact of the matter is, our traditional cholesterol lowering agents, such as statins, do not actually lower the LP little a level. And in fact, statins can increase it despite the fact that they decrease cardiovascular risk. And we do have the PCSK9 inhibitors that are injected that under the skin every couple of weeks or twice a year. And they actually do end up lowering LP little a. The interesting part is that it's only a 20 or 30% decrease, and their outcomes don't seem to be any different than what you get from statins. So not sure that changing the LP little a will actually make a difference. It may be that everyone needs to clean up their diet to make sure that all the other risk factors are not letting the LP little a turn on plaque formation and clotting. So this was an update from today, actually, where there are now 5 drugs by multiple companies. Sorry, I'm not anti, but I never want to, sorry, yeah, anti would probably be the right word, promoting commercial companies, don't have any relationships, stuff like that. And so I removed all the names and put company, okay? Hope you don't mind, but but you can follow this with these 5 drugs. They all show tremendous, that is 80 to 97% decreases when they are given to patients. And these are in phase 2 and phase 3 trials. 2 of them were reported at the American College of Cardiology last week with these huge reductions in LP little a. The real question is, what does it mean? You made a change, but did you make a difference? And the real question is it going to decrease heart attack, stroke, death, or anything that, like, we know what happens with statins and even with the PCSK9 inhibitors. So we're waiting for that kind of information. We have changed risk factors before, such as increasing HDL, only to find out that it didn't help or it increased mortality in hair. And so that plus what I mentioned about the statins dramatically lowering cardiovascular risk and yet increasing LP little a means that we really want to prove that changing LP little a makes a difference. If so, it'll help us with our healthcare disparities because of the predominance of LP little a in African Americans. But back to LDL, because that's what we know. And we know that we can dramatically decrease cardiovascular events if we lower the LDL. And so there are multiple meta-analyses that have looked at the lipid response to a vegetarian diet. And the data is actually very clear. You stop eating cholesterol, your cholesterol goes down. But it's a little bit more interesting than that, as I'll cover in a little bit in terms of what happens to the microbiome. Showing it up close, you can even see a decrease with lacto-ovo vegetarian diet, but vegan diets tend to predominate in terms of a decrease in the LDL. That was an older study. This one published just a couple of years ago. It's really confirmed it. That is, you drop the animal products out of the diet, and you will see a substantial decrease in LDL cholesterol. For diabetes, we actually have some healthcare disparities. That is, the non-Hispanic Blacks actually do have a huge black to white ratio of disparity, and our Hispanic population has a lot of it as well. Neither the Black population or the Hispanic population in general gets the level of care. And so getting access to care improves the number of patients who end up with the complications of diabetes, the amputations, the renal failure, stroke, heart failure, all of them can be decreased. If we were to diagnose it early, intervene early, get people care. So that is really the message. And yes, we could try to do everything we can to improve access to care for underserved populations. But how about improving the diet? Won't that make a difference? Yeah. So this is a publication from just under 2 years ago that was very startling, but not surprising because we'd seen it before in smaller series. And the fact is, we actually have case reports and as well as case series in my journal, the International Journal of Disease Reversal and Prevention, IJDRP. Please write that down and click on it and take a look at so many conditions that we suffer through in this country that would dramatically improve if we could just change the diet. So this one was very striking because it showed that 37% of patients who were diabetic were no longer diabetic at 6 months if they did a whole food plant-based diet. There is this intense risk association between animal protein and type 2 diabetes. And this was a very insightful article published a few months ago showing that total protein, which was really animal protein mostly, and increased the risk of type 2 diabetes. And the number to remember out of that, the real takeaway point would be just replacing 20 grams of animal protein with plant protein. That is changing a strip of bacon or because that's really 30 grams of protein. Changing a strip of bacon to a strip of tempeh or something will actually reduce the risk of diabetes by 20%. So long-term consumption of animal, but not plant protein is associated with a dose-dependent increase. That is, the more you eat, the more diabetic you are. Very similar to what we saw with the obesity data. I'm going to talk about the inflammasome, and I hope that at this point, good 20 years after Paul Ridker started talking about high-sensitivity C-reactive protein, hopefully everyone is aware of this and is actually looking at their own C-reactive protein level. But this is yet another risk factor that has healthcare disparities, and that African Americans tend to have more C-reactive protein level, a higher C-reactive protein level than whites, and women tend to have higher than men. And so often women are ignored when it comes to heart disease and underrepresented in clinical trials. And that's a healthcare disparity that we really have to take on. Underrepresented in the workforce and medicine, no longer, with 55% of our internal medicine residents to try to deal with all this diabetes and hypertension are women. But in cardiology, we're still lagging behind those numbers, and we have to do a better job. In women, the racial differences in C-reactive protein tend to be physiologic. That is, more African-American women have lupus or sarcoid, the obesity issue. Whereas in men, it seems to correlate with behavior, habits, and socioeconomic status, interestingly enough. That was actually pointed out by the University of Alabama, Birmingham crew that did such a marvelous job of showing which diets were really bad for you. And they actually showed that if you have a high C-reactive protein in African Americans, you will have a substantial increased risk of stroke. So what can we do about the inflammation and cholesterol? how important is it to change it? So this is a study published in Lancet a couple years ago by Paul Ridker, and this was that stunning graphic that, yeah, you could lower your LDL to less than 70 to decrease heart attack, stroke, and death. But if you did not address residual inflammatory risk, that is, there are inflammatory foods in your diet, inflammatory conditions unaddressed, you ended up almost doubling the risk of dying. And so we really do need to try and measure it and follow it and make sure that if it's elevated, that we do everything we can to reduce inflammation. So what can we do? Well, this was 22 years ago. This is David Jenkins' Portfolio Diet. It's a vegan diet done, excuse me, a vegan diet done with a lot of soluble fiber, psyllium, in fact. And what they were able to show is that if you take a statin, you will lower your C-reactive protein and your LDL. But if you take a plant-based diet, carefully designed, a lot of plant sterols, a lot of fiber, you will decrease your LDL and your C-reactive protein. And your C-reactive protein goes down a little faster, as you can see on the right. It's down to good level in 2 weeks, a 30% decrease. So you could say, well, that's Journal of American Medical Association hasn't really caught on. Well, this Benita Shah published this from NYU just a couple years ago. It's a very similar idea, but taking people out of the cath lab and getting them to agree to go on a plant-based diet or be randomized to the American Heart Association diet at the time before we changed the guidelines. And what you saw exactly the same thing, a 30% decrease in C-reactive protein unless you were eating animal products. And yes, the AHA diet did improve things like cancer, not so much heart disease, but it improved cancer because it was getting rid of red meat, lean cuts of red meat on occasion, mostly chicken and fish, no skin, not fried. Great, except it doesn't. And whenever you're eating a animal product, your body has to respond to that with inflammation. And so the C-reactive protein did not change from the standard American diet. So underlying all this is the microbiome. And I hope at this point, because I know I've been talking about this for several years, since the recognition is that a plant-based diet basically improves your microbiome. What is the microbiome? It is the bacteria that are in your body, and you have them all over your skin, you have them in your mouth, and you have them in your GI tract. The ones in the GI tract actually change everything. How you digest your food, how much you excrete, how much you absorb, eliminate toxins, modifying drugs. Those bacteria start breaking down what's presented to it, and the type of bacteria that you have determines what happens to what you eat. And so it turns out that there's been a lot of attention to probiotics. And I think for the last 20 years, people have been talking about and giving probiotics that really weren't getting through the gastric acidity. There are some now. There's one, at least one, that is approved by the Food and Drug Administration that really does get taken orally and still get down to the colon and survive and change the microbiome. The other way that you see here is the fecal microbiome or microbiota transplantation. That's usually done by a spouse or with the spouse's stool by an enema to someone who's suffering, for example, of Clostridium difficile or C. diff diarrhea, and which could be really life-threatening. And you put some bacteria from your spouse in there and sort of overwhelm the C. diff and get it back in order. Well, so I expect to see a fair amount of this, but fecal transplantation, probiotics with this questionable track record, how about just changing the diet, so-called prebiotic? Whole food plant-based diet can actually put your microbiome in a much a positive biome so that you don't end up with all of these particular risk factors: hypertension, hyperlipidemia, diabetes, and obesity and inflammation. All are related to it. So I want to make sure that I leave time for the question and answers. So I'm not going to go in depth into the research for each one of these, just show you. And if you have any of these diseases that I just mentioned, and you want to take a picture of the screen, this is the time, because this is the data saying that you change the gut microbiome and you can decrease hypertension. We know which bacteria are associated with hypertension, those gram negatives shown in red there. And the same thing is true for high cholesterol. But the interesting twist is there are good bacteria that have a cholesterol dehydrogenase. That's an enzyme to break down cholesterol. And so it can actually change the cholesterol into a compound called comprostanol that doesn't go into arteries. It just goes out in the stool. So why wouldn't we do that? So decreasing dietary cholesterol by doing a plant-based diet is great, but it's incomplete because unless you're taking a high dose statin and a PCSK9 inhibitor and the like, you're still going to be synthesizing cholesterol. It'll go to your intestine. You could block that intestinal absorption with a drug called ezetimibe, or you could have good bacteria that'll break it down and have you excrete it. So how much you're going to get depends on the amount of good bacteria in your GI tract. And that's why you'll see people go on a plant-based diet. And some people get a 20% reduction in LDL, and some people will get a 70% reduction. I was in that group and started this whole interest in nutrition. And the fact is, if anything that we can do to get terminal ileums, that is that piece of the bowel that does the absorption of cholesterol, getting it to go away is great. Even using plant sterols to overwhelm the receptors there will decrease your cholesterol. And the way we do all that is basically with plants. For type 2 diabetes, we have a tremendous amount of information about which bacteria in the GI tract promote diabetes and which ones don't. You have wonderful, complicated looking slides, really not that complicated. Is it changing your gut permeability? Is it changing your glucose insulin levels or inflammation? And each of one of the bacterias will actually either promote or improve your tendency to diabetes. Uh, what we really need to do is manage it. And the best way to manage it is really to do a prebiotic, but probiotics and fecal transplantation may have a role in this at some point in the future. For obesity, really important to recognize that the microbiome does everything. That is, you can eat a certain amount of calories, but the microbiome determines how much you're going to absorb, how much of it's going to be stored in your fat cells, that's so-called adipose tissue, and the GI tract changes how your brain perceives food. And it changes your appetite. And for people who are obese, it's said that uh, they're not obese because they overeat. They overeat because they're obese, meaning that the brain has changed and says you haven't had enough food yet and to keep eating. And those kinds of changes are actually mediated by changes in the gut microbiome. And so we really do need to do whole food plant-based interventions to fix the microbiome. The vegan vegetarian diet within 2 to 4 weeks can change that microbiome completely around and make it more benign. I have to mention, can't talk about microbiome without mentioning TMAO, that's trimethylamine N-oxide, which is a product of the GI tract. It was published over a decade ago from the Cleveland Clinic. I thought when this came out, with the eggs and the cheese and the steak in this graphic, that everyone was going to go on a vegetarian diet from then on to avoid heart attack, stroke, and death. Well, that didn't happen. The interesting thing is the science has moved on. We know so much more about TMAO than we did back then. Bottom line is that it's red meat is the major issue with developing trimethylamine N oxide, but is mediated by the gut microbiome. And if you can change the microbiome or just stop the red meat, you can reduce within 2 to 4 weeks, you can drop your TMAO level substantially. If you do that, you will find an improvement in health outcomes and particularly getting rid of the red meat. You can reduce all of the cardiometabolic issues that we have with obesity, diabetes, and the like. How about real, not just risk factors, but bad outcomes? Heart attack, stroke, and death was shown to be dramatically increased if you have a high serum level of trimethylamine N oxide. And if you have heart failure, the heart failure death is actually correlated with a high TMAO level as well. So this is all pointing to the fact that's been known this is 2012 from health professional follow-up study and a nurses health study. That's the Chan School of Public Health. And when people say that red meat is just fine, and saying that that Walter Willett and Frank Hugh and the whole Harvard School of Public Health is with the nurses and the doctors that they've been studying are all completely incorrect. And I don't think that's the case. What they've shown us is that red meat kills, processed red meat kills faster. It's not just cardiovascular disease, it's cancer mortality as well. And the dose response is very dense. It's a linear increase. The more you eat, the more complications that you have. And people who say anything in moderation, well, there's some truth to that. It is lower, but the biggest increase in this hazard ratio that you're seeing is between 0 and 1 serving per day. So, never would be better for longevity. We have data from other centers, like the Swedish cohort of Swedish men, that also talked about processed and unprocessed red meat being extremely higher risk for heart disease, particularly heart failure, 243% increase in heart failure. We actually have more American data and this is actually data from the Regards folks, that an analysis about heart failure showing that plant-based diet that I showed you, the green curve about 30 minutes ago, was associated with a 41% lower risk of developing heart failure. And so why wouldn't we do this to avoid one of the major increasing diseases? People say, why is the prevalence of heart failure going up? Well, it's our risk factors and our drugs. The drugs are doing so well that keep people alive. And so the incidence is going up because because of the diet, and the prevalence is going up because of the treatment. And so people are not dying like they were, 20 years ago when heart failure was considered like the cancer of cardiology, 50% death rate at 5 years. Nothing like that anymore. And we've been very clever with so many biochemical approaches to improving heart failure. But bottom line is, we're still mopping up the floor. Let's turn off the faucet. So anyway, back to red meat. It's not just heart failure. It's ischemic heart disease. That's the fancy term for blood flow lack. That's ischemia. And that occurs because we've plugged up our arteries with unprocessed and processed red meat. And you end up with substantially higher risk of heart attack and heart failure for blood flow to the heart with blocked arteries if you're eating red meat, and processed red meat is twice as bad. This is a graph that's supposed to depict diet scores. Looks like I went a little quickly there on it, showing that the more plant-based you are, the less heart attack, stroke, death, and heart failure you're going to have. So the pro-vegetarian diet dramatically lowers cardiovascular risk. So more plant-based foods, less animal foods, lower cardiovascular morbidity, mortality. So we have a fair number of studies like that. I'm just going to flash them up for a brief period of time. Red meat and the risk of coronary heart disease is really dramatic. And this one is a very special one from Frank Hugh and the Chan School of Public Health and Walter Willett, because this analysis of nurses and doctors actually took the idea, red meat is so bad for you. What can we substitute to make the outcome better? And they took the data that they had It turned it on its side and saying who's eating what. And the people who were eating nuts, for example, had more than red meat, had an 11% decrease in death rate. Well, it was true for pretty much everything. The best was soy protein. And so all those people, the soy deniers out there, I just encourage them to look at the data for cancer and heart disease. But any plant-based protein tended to do really well. One problem here, and it didn't reach statistical significance, and I think the first 3 years that I was quoting this data, I didn't really remark on this, but then something happened last year that I'm going to show you in a moment that made me take a different look at this. And that is fish substituted for red meat in their study did not show a statistically significant. Poultry wasn't significant either, but at least, and eggs wasn't either, but at least it was on the left side, meaning that they tended to lower the risk. They just didn't have enough data to make it statistically significant. But fish was on the wrong side, saying that red meat was safer than fish. How could that possibly be? People have been talking about seafood or fish as a substitute for red meat to improve health. They've been talking about that for a good 30 years. Well, then this happened. So it's 13 months ago. Unfortunately for our American population, this seems, I would say, to have been falling on ears that were not ready to hear this message. And so I've seen very little change. I haven't seen change in any guidelines about nutrition, but this data was actually very strongly indicating that we have ruined our oceans to the point that anything that comes out of the ocean has a lot of microplastics and nanoplastics. And the question is, if that stuff enters your body, what happens? So this was the article that hit the news. That news cycle was no more than 48 hours, though. Microplastics and nanoplastics in plaque. Okay, that's atheroma and subsequent events. So these are people who were scheduled for a carotid artery surgery to take out the plaque, and they sent the plaque to the lab to look to see how much plastic there was, if any. And so 150 people had a lot of plastics in their plaque, and 107 people did not. Polyethylene polyvinyl chloride. You saw they published some wonderful pictures of the plastics in the plaque. And this was the very stunning result. Hazard ratio of 4.53 is a dramatic increase, more than quadrupling the risk of having so-called primary endpoint, which was heart attack, stroke, or death over a 3.5 or 3 year period. And so I know these people, because they had carotid plaque, they had plaque everywhere. And so you know that they were at risk. But having plastic in the plaque meant that they were at way more risk than they would be otherwise. So what can we do about it? Well, first of all, we have to get rid of ingesting the things that have a lot of plastic, and that would be seafood. And I did check into my omega-3 supplement that was algae-based to find out if it had plastic, and the answer is yes. And so we have polluted the planet to the point where whatever's coming out of the ocean ought to be somehow filtered if it's possible, but it really is a struggle. Okay, so that's the fish issue. How about eggs? Eggs are often touted as a good source of protein, and they say yes, it does have cholesterol, but it raises your HDL cholesterol. Well, now we know that raising the HDL cholesterol is actually a bad thing. For those of you who haven't heard this, it's the CAN-HEART and Copenhagen trials, both showing that a high HDL level increases the death rate. So it's no longer the happy cholesterol. Oh, don't worry, we only had it wrong for 60 years. But the fact of the matter is that the LDL increase and perhaps the HDL increase that happens with the bad and what we used to call good cholesterol tends to increase our death rate. And so this was published about 5 years ago. And it showed a increase in the amount of death that people had if they were eating cholesterol, anything more than a half an egg per day. But you notice how the curve for death goes down to 0, 0. That would tell you that, if you had 100,000 people eating this much, that it would reach statistical significance. So I always remember that statistical significance isn't just about what you're measuring, it's how you measure it and how many observations you have. The fact of the matter is, 0 would be better than a little. But what they found was that in their population size, a half an egg or more per day was associated with a higher risk of cardiovascular disease. Interestingly enough, that it was reproduced in Italy, it was reproduced in Japan, and it was not too long ago, just a few weeks ago, was published from the Million Veteran Program that the more eggs people were eating, a dramatic increase in the amount of death and heart attack that people had. And so we really do need to avoid cholesterol. There's more than around 250 to 300 milligrams of cholesterol, depending on the size of the egg. And it's something that everyone needs to know, that this is making you heart attack prone. This is the Italian study that didn't show a half an egg a day. It showed more than 4 eggs a week. Yeah, that's a half an egg a day. But it also showed that at 2 to 4 weeks, 2 to 4 eggs per week, was associated with more heart disease death and more high blood pressure and, of course, more high cholesterol. They weren't the first to show all this. This was actually came out years and years ago. This is 2016 from the Harvard School of Public Health again, okay? And what nurses health study and health professional follow-up study. And what they were actually able to show is that there are basically if you look at all-cause death rate, cardiovascular disease, cancer, and or other, you could improve pretty much all of those if you just got rid of just 3% of your plant animal protein substituting with plant protein. Okay. Let me blow it up for the all-cause mortality, because it sort of helped rank order for me how dangerous animal protein can be. So you have to recognize that, though, that it was 30 years of outcomes data. So that fish and poultry were about the same. I'm not sure, based on the New England Journal of Medicine, that would still be true if you started this study today, because fish have the microplastics. But they were better than dairy. Dairy was better than red meat. Red meat was better than eggs, and eggs were better than processed red meat. And for cardiovascular disease, it was a dramatic difference. And it was interesting that the eggs didn't meet statistical significance here. Why? Because enough people had died, presumably, from the cancer egg issue, that it decreased the number of people who could have a heart attack. Not a pleasant message. So anyway, people said that couldn't be true. It was actually published again. Gutsy moved by JAMA to use the exact same title. But it is the same title. It is the same model. That is, take a large population, in this case in Japan, and model what would happen if you remove 3% of the animal protein and substitute vegetable protein. And it basically had the same result. The interesting thing is that dairy was safer in meat eaters. Not sure why that was. It might have been a substitutionary benefit, but replacing dairy with vegetables, it didn't reach statistical significance, but it was on the wrong side. Maybe the people eating plant-based nutrition in Japan need to wear their seatbelts or something, because it wasn't cardiovascular. Those were all on the correct side, or cancer, but all-cause mortality would seem to be a little backwards. Well, it's always interesting to look at these studies and these forest plots and try to imagine what led to this phenomenon. But the thing that I think you're getting from this is that every time you replace plant-based substitute the plants for the animals, the death rate goes down. Wow. Was it published a third time? It really was. This time it was from the National Institute of Health and AARP, and a little different, no forest plots, just telling you statistical significance for men and for women. And bottom line is that if you substitute plants for animals, 3%, you will get a decrease in the death rate. And for red meat, it was just very, very striking. For eggs, still very striking. And it's not just cardiovascular disease and cancer, it's a lot of chronic diseases that improve when you substitute egg protein with plant-based protein. So I do focus on cardiovascular disease, but we have to be respectful of colorectal cancer and mortality. And this was published about a little bit under a year ago. The risk factor type 2 diabetes, and as well as cardiovascular disease and cancer of the colon are all related to eating processed and unprocessed red meat. And when we stop, when we change it, we can reduce the incidence by about 30%. I also keep throwing in little bits and pieces here of things like food and the Anthropocene, that is, and the Anthropocene, I should say, as it turns out that the Eat Lancet Commission is really trying to get people to be a little bit more environmentally friendly with their food choices, and unhealthy diets very clearly cause more mortality and morbidity, but they also change the environment in such a way that those of us who have grandkids really have to be concerned. And so if you are worried about the survivability of the planet, the thing to do is to change the diet. A planetary healthy diet index is actually not just good for the planet. It's good for decreasing your own personal death rate. Three different cohorts have shown this. And we're talking about a 23% decrease in all-cause mortality if we would just eat a diet, and that is predominantly plant-based or exclusively plant-based, because it would actually be good for us as well as the planet. So the healthy plant index diet decreases the greenhouse gases and other environmental impacts, as well as neurodegenerative disease, respiratory disease, cancer, and cardiovascular disease. And overall mortality. The data is actually very strong. We would have to not care about the planet, not care about ourselves to not be on a whole food plant-based diet. I would like to go back to the veterans, not just because I'm veteran dad, but because this data is talking about a very vulnerable population. And there's an interesting Million Veteran program that has really taken a look at some of the healthcare disparities that occur, not just by race that you're seeing here, but by planet. I'm sorry, that's a Freudian slip, a planet-based diet, plant-based diet. Yeah, I can't take credit for that. That was autocorrect that first did that to me. And it says it turns out that the more plant-based you are, the better off your risk of cardiovascular disease is. It just plummets. And it plummets more in African Americans because we're starting at a higher risk diet. If we look at, so you've seen a lot of stuff mostly focused on protein sources, and plant protein is associated with inversely associated with all-cause mortality, and processed red meat, eggs, unprocessed meat, dairy products, all of them are increasing mortality. So this is a newer analysis from just a few years ago that it has so many similar articles with the same conclusion. And you could look at substituting, or in this case, look at the ratio. How much plants are you eating versus animals? And the bottom line is that when you replace the red meat and you have a higher plant to animal ratio, you end up with the greatest cardiovascular benefit. Okay, so let's get away from protein for a moment. Everyone's talking about protein all the time, but there's more to it. That is, people don't go and say, I want a dose of, or I want a meal of animal protein. that animal protein comes with animal fat. Okay. And if you look specifically and dissect all the data that you can get for plant versus animal fat, you get exactly what you would think. Okay. Plant fat, and I know we've had for a couple of years running, we were having this debate with some of the plant-based gurus who say no oils. Well, the data from, I think that's fairly accurate if a person is overweight, diabetic, central obesity. If you're a thin person with an elevated cholesterol, then you might actually benefit from the kinds of oils that decrease LDL cholesterol. And that would be those who have monounsaturated fats and polyunsaturated fats in large amounts. So examples are olive oil, which everyone's heard about, but canola oil, avocado oil, grapeseed oil, there are a handful of them that actually lower cholesterol. And so for those folks and anyone who says no oil at all, they need to look at this data. So almost 500,000 people with long-term outcomes. And you saw if you're eating the oils from a healthy plant, okay, fat from grains, fat from vegetable oils, you saw somewhere around an 8 to 12% decrease in death and even higher decrease in cardiovascular death. Okay, so the no oil issue just needs to be kind of looked at from that lens. However, really true that animal fat, and I know that people are saying butter is back, and and there are people who are saying that saturated fat is not as bad as people think it is, and that the problem is the animal protein causing the TMAO. It's hard to argue that because again, people are eating, an animal product that has a lot of stuff in it and has a lot of stuff on it, like advanced glycation products. And if you barbecued it, it's polyaromatic hydrocarbons and heterocyclic amines, but people still put animal protein on a flame as if that data was not published already. Egg fat, very similarly, increases mortality rate. So we're talking 13 to 16% increases in cardiovascular and overall death if you're eating animal fat, including egg protein. So the data is actually very clear. No one should be eating animal products, and you don't necessarily have to avoid plant-based oils if they fit the bill of having cholesterol-lowering properties. So it's interesting. I still recommend those no oil diets for the people who are struggling with weight, however, because it doesn't matter which fat you're talking about. They all are 9 calories per gram, and they do end up increasing the weight for people. Another interesting one that was published a few months ago that may be somewhat fascinating to me is that we all have been on getting away from cow's milk and the growth hormone and the saturated fat and the cholesterol of cream and milk and skim milk is a little better than the rest, but it's still, resulting in dairy farms with the greenhouse gases and the mistreatment of the cows. I mean, you put all of it together, and who would do cow's milk and plug up your arteries with that? Well, interesting, we haven't had a lot of comparisons. This is one of the first comparisons that I've seen that focuses on milk, not the protein, not the oil, but just the milk, okay? And what it showed is that soy milk is way healthier than cow's milk. And the hazard ratio for events that you're seeing, the forest plot, so-called forest plot, it's everything is on the left. The one exception was, you see here, is that if it's sweetened soy milk, and I know that's popular and maybe tasty, if people are, that actually does tend to increase fasting insulin levels. It still lowered blood pressure, still lowered A1C, surprisingly, but insulin levels do go up if you're doing any kind of sugar, including soy milk. So I'm going to go back to the another analysis of the million veteran program And I know it looks sort of duplicative, but I really want to emphasize that if you have and it doesn't have to be a Black person, it could be anyone who's identified as a high risk person. You really have to emphasize, spend that extra few minutes talking to your friends, or if you're a physician, talking to your patients who are at risk, saying that, you really do need to change your diet. And this is the data. It's a dramatic decrease in cardiac events if they do a plant-based diet. And if the more unhealthy plant-based diet, okay, um, that you have, and that's the reason to show this one. What is an unhealthy plant-based diet? Well, that's where you take a potato, which is healthy, and then you fry it, which increases the fat content by 66-fold. Uh, so we don't really want to do that. So an unhealthy plant-based diet, with a lot of sugary things. I know they're very popular. Vegan donuts, vegan beignets, vegan red velvet cupcakes, vegan ice cream. That sugar content and refined grains and fried foods. If we put all that together, it's unhealthy and it increases events. Okay. And it's true and there's no disparity there. We're all human, and you end up with worse outcomes. I'm going to get back to that in just a moment, but I do want to deal with one issue with the fish issue, because people were saying that, and a lot of cardiologists still recommend a Mediterranean diet instead of a plant-based diet. And it's based on what you see in the upper left here, a 30% decrease in heart attack, stroke, and death if you did a Mediterranean diet instead of the red meat full diet or control diet. But I want everybody to understand that this was a heart attack, that's acute myocardial infarction, heart attack, stroke, or death from cardiovascular causes. That is so-called, the primary endpoint is a combined endpoint. This, okay? Suppose they're all different. You're kind of mixing them in together. And so if you look at overall death rate, they're about the same. That's number one. Number two, when you do look at the the secondary endpoint, that is the individual components, you find a completely different story. Shown here in magenta is that if you change your red meat to fish, you will decrease your stroke rate. Okay, at least in the Mediterranean study that was published in 2018. The data was initially published in 2013, about 3 years for analysis. So it was done, over a 7-year period, so probably 2003-ish. And the oceans were not the same. And so I'm not sure you could reproduce this today, but fact is that you actually had a dramatic decrease in heart attack, in stroke. But if you looked at heart attacks, it was about the same. If you looked at death from cardiovascular causes, about the same. It didn't matter whether you're doing extra virgin olive oil or nuts, you ended up with about the same rate of heart attack and cardiac death. Overall mortality, as I mentioned, really no difference. So what we learned from here is that getting rid of red meat cut the strokes in this study. Very well done study. But please, please let any heart doctors know that they shouldn't be recommending it based on this trial, because it didn't show a cardiac benefit. It only showed a stroke benefit. So anyway, they're really great people. Ramon Estruck is in our American College of Cardiology work group. And so I was very glad to see that they actually did an analysis of plant-based food out of that same study. And what they showed is, as opposed to no benefit, no mortality benefit, if you were doing a vegetarian or pro-vegetarian, the highest quintiles of food, plant-based food intake, you could call it a vegetarian diet, it showed about a 42% decrease in heart attack, stroke, and death and mortality. So this was actually very dramatic. I'm very glad that they published this. It didn't get the same press because it's not a popular message that you need to be not Mediterranean, but vegetarian. If we look at the planetary, I'm going to give you a handful of more of these dietary patterns, just because there's so much published on this. And I know I'm going through a lot of stuff, all of it pointing in the same direction. The planetary diet index is something that we all have to recognize because of the decrease in mortality that we see with it. Okay, all right. I'm going to go back to processed food for a moment. Everybody has an idea what's processed and what isn't processed. And you have a NAVA sort of categorization of processed and ultra processed foods. And are they really bad for us or not? They certainly turn on taste buds and they get into our brains, and the dopamine level goes up and it makes it hard to avoid. But I can tell you that there's a lot of processed stuff. Minimally processed, that would be a carrot. Processed would be carrot juice. Ultra processed, that'd be a carrot cake. And by the time you put in the refined grains and the sugar, that should be associated with a high amount of cardiovascular risk and a cardiovascular uh, uh, events over time. So this, similar to the Million Veterans Program, this was published also by the Nurses Health. And so, military, nurses, and health and physicians uh, all have the same phenomenon. That is, if you're eating a unhealthy plant-based food, that is frying stuff, refined grains, sugar, you end up with this dotted line, more coronary heart disease than even eating animal products. So I know those are popular, and the animal rights folks and the planet sustainability folks really like that kind of stuff. And I tell them it's a really good thing for the planet because it decreases the human population. That's not a popular statement, but that's what the data shows. So we ought to be doing a whole food plant-based diet, not just a so-called vegan diet. Uh, well, this was published a few days ago, and it was 3 years of work. And my shout out to my co-authors who helped collect all this data all over the world. We actually have a serious amount of restaurants pretty much everywhere I went, lecturing, tennis events, cities that I was living in at the time, and my co-authors the same way. We would actually look at an app like Grubhub or Happy Cow and look for vegan food, and then try to evaluate how healthy that food was. Okay. So it's 561 restaurants in 37 cities. And the bottom line is it's really not healthy. We have a dietary pattern that's a little bit worse in vegan vegetarian restaurants than they are in omnivore restaurants with vegan options. But overall, what's being fed to people in restaurants is unhealthy. This is the data. What you're seeing in red is the vegan vegetarian options um, and or entrees that are healthy, meaning a whole food plant-based, and we measured health based on the presence or absence of refined grains, that's white rice, white pasta, white flour in the bun on the veggie burger, versus saturated fat. And there, we have struggled for a long time with anything with coconut oil, having a lot of saturated fat in it, and fried food. And I should note that fried food is not much of a cardiovascular issue. It's an obesity, diabetes, cancer issue. But bottom line is it's not healthy. And so what this graph is showing you is the odds of you walking into a restaurant that says it's vegan, vegetarian, or omnivore with vegan options shown in blue, and having 10 items to choose from is highly infrequent. And if you define a high number of healthy options as 7 or above, it's a quarter of the vegetarian vegan restaurants and more like a seventh of the omnivore restaurants. And when you look at the number of where you walk into particularly in blue, You walk into a omnivore restaurant that says it has vegan or vegetarian options, and you go through it and find what are you going to find? Unhealthy stuff. And so zero options, one option, two options. That is actually the majority of the non-vegan vegetarian restaurants. So restaurant food is a problem. Just so you know, what do you have to watch out for? Pretty much refined grains. They're everywhere. And the Asian restaurants have a lot of white rice. And, we gave them credit if they were serving white rice, but they have brown rice as an option. You give them credit for that as being healthy. But the saturated fat issue, I know it's getting better because one of the popular brands of artificial plant-based meat changed from uh, the high saturated fat in coconut oil to avocado oil last April. And so that is a little bit better. And we started changing the grading system after that was published for those particular restaurants. But fried food is another major thing, and it tends to be a big issue in the vegan restaurants that everything is fried. So we really struggle with healthiness in going out. And so I would like to, what I'm hoping is that everyone will see this and the restaurants will bend to the will of people who say, hey, can you come up with some options that don't have refined grain, saturated fat, or fried food? Okay. Going to spend a minute or two talking about the cardiorenal disease, just because it's something that everybody should know about plant versus animal protein. Getting back to that, animal protein creates kidney disease, and plant protein can save the life of the people with chronic kidney disease and save them from going on dialysis. So why is a cardiologist talking about it? Well, it's because renal disease is so important to heart disease in terms of management, but in terms of, people don't generally die of kidney disease anymore. They die of the cardiac complications of kidney disease. And so red meat is very much associated with the development of dialysis or going on to end-stage renal disease dialysis. And the best way to manage people who have chronic kidney disease is to put them on a plant-based diet. And this isn't just the request from a plant-based journal editor. This is actually a lot of peer-reviewed literature, all saying the same thing: improves symptoms, metabolic complications, and stops the progression of those stage 3. Stage 5 would be going into dialysis. Stage 3 is you're over halfway there. And so fact of the matter is, if you do plant-based protein, and this study was done with soy protein, it decreases the blood pressure, decreases the thickness of the heart, decreases the phosphorus and cholesterol levels, urea levels go down, and people lose weight in a positive way. And what you end up with is less progression of disease. One of the theories for the first few years that this data was shockingly published and more shockingly ignored was that this was the acid load from animal protein that was doing this. And so what they recommended was, let's just use bicarb. So they tried it, plant-based nutrition versus bicarb. And what they found is that you ended up with a dramatic improvement if you were doing plant-based nutrition, but not the bicarb. This actually study is talking about the chronic renal insufficiency cohort. And it actually looked at not just progression of disease, but all-cause death, dramatically improved if you're doing a plant-based nutrition index. This is the dietary acid reduction for people who have hypertensive kidney disease, and definitely showed an improvement if you were using plants, fruits and vegetables rather than bicarb. So anyway, bottom line is that this has been out there on the internet for quite a while. National Kidney Foundation asking people to, if you have kidney disease, high blood pressure, diabetes, go on a whole food plant-based diet. And you would think that everyone would listen to the National Kidney Foundation, but it has very little traction. I've seen, obviously my folks who work for me at University of Louisville, yes, and University of San Diego, and in any place that's actually published one of these trials, but the rest of the country is not doing it. I'm going to mention as we come sort of to the tail end of COVID, we should have had the guts to go out there and tell everybody to be on a plant-based diet because everyone was saying that folks were not dying of COVID when they were plant-based. The data did come out in late 2021 that, yeah, not only were they not dying, but the odds of having a significant illness, moderate to severe illness, was reduced by 73% if you were doing a plant-based diet and increased by almost 50% if you were doing a low-carb animal-laden diet. And so that sort of put a damper on the vegan versus keto diet wars for a bit until the COVID sort of died down a bit. And then they're back saying that people should be eating animal products almost exclusively to lose weight. It does, to be fair, it lowers weight, which lowers diabetes and lowers hypertension, but it increases cardiovascular mortality, and in this case, COVID, because of the bad microbiome and the cytokine storm that people so famously heard about that's coming from the microbiome. So this was an interesting one published a little more recently, sort of at the tail end of COVID, saying that if you're doing a vegetarian or plant-based diet, the odds of you getting COVID was way lower. You could argue if it's excuse me, an observation bias because sick people don't go get tested. I'm sorry, people who aren't sick don't get tested. And that might be part of this, but it was very clear that the improvements in outcomes with COVID, that all we needed to do, not saying that vaccines didn't help, there's 16-fold improvement in mortality, but that's mostly in people who are eating a bad diet. Wouldn't it be nice to go back 5 years, have everybody do a plant-based diet and see what would happen? So anyway, I'm going to sum up here and open it up for questions in a bit. And I know we've gotten a lot of questions already, but we can go through enough of them for maybe 30 minutes or so. But I do want to say that the American College of Cardiology and the American Heart Association did ask me to help put together nutrition guidelines. I used all of the data that was available at the time. A lot more has been published in the last few years that you've seen from me today. But enough of it was there to actually say that we should be doing a diet that's beans, grains, nuts, seeds, fruits, vegetables, and mushrooms. Fish swam their way into my section because of the stroke benefit and the American Heart Association being a stroke organization. And so I couldn't argue with that, but I did try to make sure that everybody understood that in recommendation number three, people should be decreasing sodium. That would decrease the fish as well. And I hope people heard that because that would decrease the amount of microplastics that you'd find out about later. The nutrition recommendations haven't been really taken up very much by folks. I'm hoping that we could do a little bit better. We've got a lot of media out of the twin study that was on Netflix, You Are What You Eat. It actually showed with a couple of peer-reviewed articles that it not only lowered cardiovascular risk, but it actually lowered aging. So anyone who doesn't want to get older faster needs to actually go on a whole food plant-based diet. Getting back to the healthcare disparity, I just want to shout out to the Adventists who were very early on this issue of racial disparities and being able to decrease hypertension, diabetes, high cholesterol, if in the African American population in their congregation, if they did a plant-based diet. Not a pesco-vegetarian diet didn't help at all, but being a vegan vegetarian actually did help. We did a similar study on the south side of Chicago, not observational, but prospective at President Obama's old church on the south side. And we actually used those guidelines just about the week they were published because I was co-author and I knew what they were going to say designed a study to try to see what would happen to all the risk factors. So all the ones that you're seeing with dramatically improved over a 5-week period. And we actually graphically showed the most dramatic percent reduction was the TMAO level and the insulin level, but pretty much everything got better and was statistically significantly better. So what we learned is that, yeah, you could do a plant-based diet that would improve things dramatically. I didn't make a slide on it, but I actually, this is our Association of Black Cardiologists cookbook. And it was a wonderful tool to give to people to try to lower their risk. I don't use it anymore, starting about 3 weeks ago when I started using artificial intelligence because I realized suddenly that every cookbook that's ever been written is what the author wanted to eat and not necessarily the patient. And so I know I could lose some friends over that. But what I started doing is you tell me beans, grains, nuts, seeds, fruits, vegetables, and mushrooms. What do you like and what do you not like? And some person would say, I don't like mushrooms, but I really love corn and peas. And I'm saying, what is it that I could give you in terms of a cookbook that would make you want to do a plant-based diet? And once they say what they want and what they don't like, I put it in the AI app and ask it to give me a 2-week menu, give me some recipes, give me a shopping list. It takes about 30 seconds to do that. So I'm actually doing individualized cookbooks now. I still give out the ABC cookbook just as a reference, but probably out of habit because giving people what they want, I think, is the most important thing that we could do. Why is this so important? And why am I doing this intervention in the clinic? Because we are the problem. We have met the enemy and he is us, that famous quote. We are eating bad stuff. So this was the saddest publication of my career, 274 physicians collected from Rush and Loyola, and one plant-based person, 11 people following the ACCHA guidelines, if you include fish, and all the rest eating things that are known and published to increase their death and illness rate. And so this picture, I've shown it many times, of processed meat and eggs, the two worst things that we could do for animal protein, being served at a preventive cardiology meeting. What we really need to do as physicians, and if you have a physician who's not doing this healthy stuff, please suggest that they look at the American College of Lifestyle Medicine website and get them to eat plants, do exercise, manage stress, which is tough on physicians, not do substances. Make sure that they're sleeping and have healthy relationships. So this is actually not my last slide. It looks like my last slide, saying more attention to prevention. What I've been talking about for an hour and a half now is decreasing heart disease, kidney disease, and stroke that with improvements in our diet. It would dramatically improve our healthcare costs, and it would remove a large number of our healthcare disparities, particularly in cardiovascular disease. The whole food plant-based diets can actually reduce all of the cardiovascular risk factors and decrease a number of diseases. And I'm going to not read the ones in that middle paragraph because I've got sort of a surprise slide at the end. And what I'm hoping that everybody will understand in the medical world, and patients can drive this by talking to your doctor, that prevention in cardiology means that we're going to reduce the risk factors wherever possible, and that's through improving the microbiome and decreasing the events associated with nutrition-related illness. So my surprise slide, which I'm not going to talk about, I'm just going to show it to you. And I'm going to leave it up on the screen and for a moment, and hopefully you'll take a picture of it. And the assignment is send me anything you think I've left off. Okay, that's the challenge. Okay, so this is the list of diseases, a lot of which I've talked about today, but I've really talked mainly about heart attack, stroke, kidney disease, heart failure. There are a lot more that are not in the cardiovascular arena at all. A lot of them are in my journal, IJDRP. but it's this peer-reviewed literature all showing that these diseases, of which there are 73, if I have it counted correctly, are related to consumption of animal products and can be reduced or improved or even eliminated with a whole food plant-based diet. So your assignment is to, do a screen capture or whatever, and send me a note if there's something that you know of. I then go look up the literature, and if it has good peer-reviewed data, it ends up on this list. And with that, I think we have about 20 minutes left for questions. Thank you so much.
Great. Thank you for all the information that you shared with us today, Dr. Williams. So, for people in the audience that want to follow your work, purchase your books, maybe get in touch with you, how would they go ahead and do that?
So let me just say, no slight of all my colleagues who write books. I would never write a book.
Oh,
Uh,
okay.
did you see that whole thing of like HDL, happy cholesterol, increasing the death rate? Come on, if I had put that in a book a few years ago, I would just feel so bad. The issue is that medical knowledge doubles every 73 days. So anything I put in a book is likely to be, it has to be tested. And I have said, as a chair of medicine, I've asked my faculty to adopt AI for this reason. And anything you haven't looked up in the last 18 months, don't tell a patient that unless you're looking it up right there at the time with them. It happened to me yesterday where all this time I was thinking that our oral blood thinners were all the same. I'm not going to say which brand, but a patient said, "Well, I heard that this one was safer than the other." Say, "Oh, I don't think that's true." But you know what? I haven't looked it up in the last 18 months. When I looked it up, absolutely, it's true. And so those two main brands are very different. And it was all published in the last few months, and it got by me. Why? Because I spent all my time reading about nutrition. Okay, so
Great. All right. So no book. How about if they want to follow your work?
well, there's the IJDRP. I hope everybody's writing that down, ijdrp.org. And you'll get to see a lot of stuff from me as the journal editor. I summarize we just had an edition come out the other day, and with several articles, and I give my perspective on it. We do a few pieces. Sometimes I'm actually doing invited editorials. I tend to do conversations with a legend, people like Dean Ornish, Caldwell Esselstyn, people like that. And so it's been really wonderful. So someone said they didn't get the website, ijdrp.org. I actually had a bunch of people because I was talking about, I didn't mention it today, but one of the articles that just came out was chatting with ChatGPT. That is, what are the barriers to people becoming a whole food plant-based diet? I actually asked my artificial intelligence if a whole food plant-based diet can decrease chronic illness, mortality, our toxic healthcare costs, save the planet, and avoid animal abuses, why wouldn't everyone do it? And it gave me 10 really good reasons. And so I think people would enjoy going through that and learning things that I had to learn because I actually double checked ChatGPT on every single one of them and found out things like those tastes that people want for red meat and stuff like that. It comes from being in the uterus of a mother that ate it. There's so many interesting things that are barriers. The one that I had to call it on was saying that plant-based diet's more expensive. It's not true. And there's a little table in there where I double checked it and made sure that it understood that beans, grains, nuts, seeds bought in bulk are way less expensive than chicken, fish, and pork and beef. So ijdrp.org. I hope everybody enjoys it. It is free. I know some people were saying, "Oh, I wanted to pull your article, but it was going to make me pay for it." No, no, no. All it's asking you for is your email address so that you're a registered user. So all you have to do is subscribe, and it's completely free.
Thank you. So for somebody that wants to be heart attack proof, but live in the real world,
Hmm.
you have the Esselstyn and he, gets rid of all the oils, and you talked about the oils today and how they can be in a healthy diet. What is, and I know it's drastic, but what's the least amount we can do but be heart attack proof? Meaning, if we go to the all the way down to Esselstyn, but where do we go back up where we're still heart attack proof?
So I wish there was such a thing. The heart attacks, the best answer is the heart attacks are related to the area under the curve, okay, for LDL cholesterol. And it's probably a few other things like TMAO and inflammation and hemoglobin A1, a lot, blood pressure, smoking, okay. But fact is that we need to start early. That's what we need to do and fix all of those risk factors. So I would say the best way to be heart attack proof was to take that ACLM six pillar slide, talk about social connections, stress reduction, avoidance of substances, which is horrific. Get out of the chair and the sofa and exercise daily, and do a whole food plant-based diet starting in childhood. That would make us heart attack proof. The other diets, they if they were publishing that today, they would say no, it's not heart attack proof because even the statins, and hate to admit it out loud, but the data is very comparable between plant-based nutrition and statins, and that's why I use them together. And so far, I haven't had anyone who was doing both of them and doing them both well, taking the statin all the time, complying with a whole food plant-based diet, have any cardiac events. Well, each one of them lowers the risk by 26 to 35%. And so, even the best whole food plant-based diet is not going to be heart attack proof. Probably, maybe it would be if you never developed any risk factors, and that means you started in childhood.
Okay. And regarding statins, are there any side effects like diabetes from statins?
So really important, that is the blood sugar increase, hemoglobin A1C increase with high dose statins is a referendum on how much central obesity and metabolic risk you have. And so, yeah, admittedly, if you are diabetic, that was one of the first large randomized trials that showed that atorvastatin lowered the event rate in diabetics. So really important concept that it saves the life of diabetics. So increasing the blood sugar, tipping people from pre-diabetes over into diabetes and saving their life. Wouldn't it be nice if they didn't do that? Well, the best way to do it is to get rid of the metabolic risk. And if you still have an elevated cholesterol or coronary disease, then take the statin, and you're not going to be at risk of having diabetes if you get rid of the metabolic risk. And how do people do that? It's actually not that hard. It's central obesity. And if you're doing the exercise and plant-based diet, that central obesity is going to melt away.
Thank you. So you, in the beginning of your presentation, you spoke about the former president of, I don't know if it was the College of the American College of Cardiologists, I believe, the outgoing president,
Kathy
and you
Kagan?
asked her about prevention,
Yep.
but you didn't give what her response was. What, what
Oh,
do you?
actually, her response was really good. That is, she was setting, we have a prevention council, but she's actually making a separate, as sort of an outgoing executive order. She mentioned that she was actually going to do a have a prevention work group that comes up and gives special recommendations to the college about how to make more of a convention with attention to prevention, which was my little quote to her. So I was really happy to hear that. She didn't ask me to be on it, but that's okay. Okay. And then maybe it doesn't need to be me because, actually, we do have a little bit of unpublished data that my little stint 10 years ago as president had an impact on the college. Pretty much every offering that we have for food has plant-based options now. We have the nutrition work group, which is really spectacular. And we are hoping that we will continue to have plant-based nutrition. I did a little survey. It's called CardioServe, and just analyzing the data and writing it up now. But that little 1% thing that I was showing before, and academic physicians, it's 8% of the people who are responding. said that they were plant-based now. So I think cardiology is, for physicians, is leaving the way.
So
Somebody say, can I interrupt for a second? I'm
yeah,
just
absolutely.
watching the little thing go by. Somebody said I strategically skipped. Was that talking about the rest of the side effects? You were asking specifically about blood sugar. But let me go back if people feel like I shorted them. Do you see what was that talking about statins?
I thought the question was, do statins have side effects? Basically,
Yep.
does
Okay.
statins have side effects?
Absolutely.
And
Okay.
it's
So the important
okay.
thing, so it says no side effects. No, there are side effects from statins.
No, no,
Okay.
no.
So,
I think she was correcting what you were saying. Yeah, she's responding to you. Yeah.
oh,
So
okay.
yeah,
Yeah.
side
All right.
effects of
So,
statins, but we'll just go with that.
right. So I don't want to hijack your train of
No,
thought
not at
here,
all.
but
No, no, not a
I
problem.
just want to see that. So the issue, certainly not strategically, if people think strategic, that would mean that I'm like in bed with the pharmaceutical industry. You've read nothing about me. They haven't slashed my tires. They haven't keyed my car, but I've been nothing but anti-pharma. And I'm going to take a few seconds just tell you why. We pay for drugs 3 times Germany, 3 times France, twice Canada. And until recently, there just hasn't been enough movement in terms of negotiation of those prices. So I met with the president of pharma. I know it was 20 years ago, but I don't think their attitudes have changed. And I said, why do we have to pay for it? Why do we have to pay these prices? And his answer was research and development. I said, did you just tell me that the United States population has to pay for research and development of the entire world? And he looked at me coldly and said, yes. So, as a person who deals with healthcare disparities, I'm here to tell you that these toxic prices of drugs that have been highlighted all over, particularly these GLP-1 inhibitors, where the country that developed them is charging a tiny amount and they increase the prices by 1,000-fold over here because they can get away with it. No, I am not a fan. And so, no, I have no conflict of interest. And if I was going to develop a conflict of interest, it wouldn't be the pharmaceutical industry. Have they done some good? Yes. But could they do a whole lot better? I believe that they can. I think our government now thinks that they can, and that we're looking for the expansion of the list of price negotiation. What I'm hoping is that there won't be a list, that we're able to negotiate the prices of every single drug because people in the underserved community, particularly African Americans, are dying because they can't get access to things that other people can. So not a joke. Sorry to go on a diatribe, but I saw that in the chat.
No, no worries. So, all right. So to avoid that
Back to
hearing,
statins.
what are the
So
side effects?
the issue with the statins, statin-associated muscle symptoms, I want everyone who's interested in that to look up the New England Journal of Medicine Samson trial. It was just amazing. We were actually uh, surprised to find out that this is the so-called nocebo effect. That is, if people keep talking about having statin-associated muscle symptoms, it becomes true. Now, this was a big lesson for us in cardiology. Now, we should have known it once we saw so-called Takotsubo cardiomyopathy, that stress from the brain can cause a heart attack. Well, the perception of side effects can actually make side effects. And if we don't have respect for the brain, we're never going to treat patients well enough. So anyway, the standard answer would be that yes, up to 20% of people can have statin associated muscle symptoms, that you typically would switch from a water-soluble statin to a fat-soluble one if you're having it, or vice versa. You would typically try to change the dose and add other drugs to make up for the benefit of statins that people are not getting when they have the muscle symptoms. But the Samson trial actually showed that the placebo, they had 3 bottles, a bottle of air, a bottle of statin, and a bottle of placebo that looked like the statin. And the symptoms were very similar between the placebo and the statin in people who had already identified themselves to get in the trial as statin symptoms. That was a big lesson. That is, the brain is probably way more important than we ever gave it credit. And so it does call into question how much of the statin-associated muscle symptoms are actually real. I know for sure that people taking CoQ10 can actually improve their symptoms, But is that a nocebo or placebo effect? I don't know. All I can say is that I do believe that it does occur despite the Sampson trial, and that our little algorithm of changing the statin, reducing the dose, reducing the frequency, adding other drugs such as ezetimibe and now bempedoic acid, as well as the PCSK9 inhibitors, can lower the cholesterol. But please, you'll be impressed with the Sampson trial that what we thought we knew about statin-associated muscle symptoms isn't all the whole story.
Okay, thank you. So Dr. Campbell, he in his latest book, The Future of Nutrition, he talks about how things like he says cholesterol does not a dietary cholesterol does not increase serum cholesterol. He said that statement, and he said that saturated fat is not really the problem. It's a stand-in for animal nutrition. I'm sorry, animal protein. And where so it's appealing to the industry to focus on the fat 'cause you can kind of trim it or reduce the saturated fat, but you can't take the protein out of the animal product or else you don't have an animal product essentially. What are your thoughts on those statements in general?
So just remember, maybe I do have a thought. Maybe I did actually give an opinion. I'm trying to remember. I don't think I gave any opinions, or I don't have any thoughts. All I do is read
Okay.
and put it all together. So
Sure.
not fair to ask me my opinion, but I would say that that there are studies that look specifically at saturated fat, showing that they increase cholesterol. They are in the context of diet, but you can actually add lard or tallow or schmaltz, animal fat, and see a rise in cholesterol. So I'd be interested in his data that underpins that statement. And the dietary cholesterol thing, I did show the slide on microbiome. It makes it very clear that you could deal with your cholesterol better if you have a plant-based diet. And so I'm sure I would say, based on the articles that I was presenting, that people can go back to that slide and look at the reference, that dietary cholesterol does play a role in serum cholesterol, but it's not as big a role as we once thought it was. A lot of that change is because we changed the microbiome when we dropped the cholesterol. So I'm hoping that it's probably a combination. And so again, I would look to see the peer-reviewed literature that underpins that statement, just because I wouldn't want people to think that they could get away with somehow with eating cholesterol.
Sure. And if you want to look at T. Colin Campbell's work, it's specifically in his last book, The
Yep.
Future of Nutrition. I think it was part two. Uh,
The underpinning articles would be what I'd
yeah,
be.
yeah. He's pretty good at referencing stuff.
Okay,
So,
cool.
so you mentioned a couple of, well, you mentioned drugs, right? And
Mhm.
marijuana has become very prevalent
Oh,
to, where it's made to seem like it's almost like the red wine, like red wine was a few years ago, where it's a health food, right? Where it's at least neutral, if not bad for you. Same thing with coffee, right? Did things like marijuana, which is ubiquitous and treated as if it has no health ramifications, coffee, the same thing? Are those things neutral? Are they good for you? Are they bad for you?
they are diametrically opposed. So first of all, I encourage anyone, including the state legislature of Illinois, where I just left 2.5 years ago, to just put it in a search engine, Google something, marijuana heart attack, marijuana stroke. And it turns out that it's dramatically increasing heart attack and stroke. And it's not just smoking it. It's in gummies or what do you call it? The little brownies or however you eat the edibles, smoking it's all the same. And it is now one of the leading causes of heart attack in young people and stroke in young people. Just please, everybody, tell everyone you know that marijuana is amazingly dangerous. And just put it in your search engine and you'll see massive amount of literature come up. The opposite is true of coffee. A little embarrassing that for 60 years we were telling people with atrial fibrillation, don't drink coffee. It's going to, set off your heart. Turns out that was completely wrong. And atrial fibrillation is among several diseases that are now proven to be reduced by coffee. And the thing that's kind of shocking to me is that most people don't drink coffee the way I'm doing it. That is coffee with plant-based milk, unsweetened. Most people are putting cream and sugar in it. And still, on top of that, we're talking reduction of diabetes, reduction of stroke, longevity, and everybody ready for this? Pancreatic cancer going down with three to 5 cups of coffee a day. So that data's been out there since about 2015. And so for the last 10 years, I'm trying to drink 3 to 5 cups a day. It's not easy if you're not used to doing it. I think I'm getting there, pretty close to doing it. But please keep up with the literature on that. And that's another easy Google search. You'll see what are the benefits of coffee. And you know, I could buy all this stuff, but pancreatic cancer and atrial fibrillation, those are just stunning.
So just a real quick follow-up because we only have really we don't even have a minute. But Dr. David Amen, who I don't know if you're familiar with his work, he does brain scans. He's reviewed tens of thousands of brain scans. You know, so on the marijuana front, he's shown like there are literally in the brain scans of people who smoke a lot of marijuana, there are dark spots. So he
Yeah.
agrees with you on that front, or his research agrees with you. On the coffee front, he says that the coffee, or maybe specifically the caffeine, I'm not sure, reduces blood flow to the brain by 30%. Have you seen anything like that?
I have not, but you know, I would love to see that in a peer-reviewed literature because that's clearly after 2 hours with me, you know that that's my addiction is peer-reviewed literature.
Right, right, sure. All right. Well, great. Thank you so much for all the information that you shared today. Dr. Williams, it's been an absolute pleasure to have you share all your knowledge with us once again. So if we can unmute the audience, please.
Thank you.
Thank you, Dr.
Very
Williams.
much.
Thank you. Like
Informative.
that.
Love
Yeah.
it.
Keep on
Thank you so
going.
much.
Thank you, Dr. Williams.
Soft
Thank you.
Yeah.
Thank you.